how do you differentiate between what is actually good pain and bad pain? What is the role of physios in a good surgical recovery? Hello everyone, we are at SportsMed again, and today I am very, very excited to be speaking to Dr. Anant Joshi. Dr. Anant Joshi is one of the premium knee surgeons in the country, but obviously one of my first mentors when I came to India. I set up my first business in rehabilitation called Heal with him, and I'll never forget, this is actually quite a funny story. People ask me, how did Heal start? I said, I was at the Kumbh Mela, I ruptured my meniscus, I phoned Doc, he operated at me at 6 a.m. in the morning. 8 o'clock, I woke up, he brought me down here. He says, the space is free. Let's set up rehab. And that's how the story of Heal started. So our journey goes back 15 years. I've learned so much from him in the way he approaches knees, in the way he approaches health, conservative care. And I'm thoroughly excited to be having this conversation. Doc, how are you doing?
Very well, thanks.
Yeah.
Nice to see you after a long time.
Long time. Also, phenomenal cyclist. He got me into cycling, It's a funny story. I used to think cycling was very, very easy until one day he told me, let's go on a bike. First ride that they ever took me was to Pune, 150 Ks. I will never ever forget it. I was in a lot of pain. I didn't realize how slowly you go up a gut. I'm looking at, that was a very humbling experience because I'm looking at my speedometer and it's like 2.5 kilometers an hour. And I was like, oh my God, gracious me, I had to go back. My entire respect for the sport, for them, what they do every single day, coming here completely changed. Doc, amazing. Thank you so much for everything over the years, for the guidance, the help, and I'm thoroughly excited to have a conversation. Doc, you're looking at, you've looked at hundreds of thousands of knees and stuff, If we look at the knee joint, legs as such, knees as such, they embody more than just a joint. Your dreams, your hopes, your aspirations, your ability to travel, your ability to explore the world, your ability to realize what you want. Everything is directly connected to the health of this one joint.
Absolutely.
And people don't really see it like that, And, what are your thoughts around, how do you go about starting to educate people on the importance of this joint? And what are some of the biggest mistakes you see people making with respect to keeping our joints healthy, knees and generally?
I think we all know that the knee is the key to locomotion.
Yeah.
And whether you're walking, running, cycling, rowing, whatever, the knee plays a pivotal role. It's a very complex joint, and although it seems like a simple hinge joint, it allows you a lot of rotation, which you see happening in footballers when they are pivoting, twisting, turning, any racket sports. So it's a complex joint which is not just dependent on the bones, but also on the muscles surrounding the joint. And a lot of people somehow tend to ignore the importance of the muscle in protection of the joint.
Yeah.
Very often when patients come to us with a knee issue, we find that either their muscles are very weak or their muscles are very stiff.
Yeah.
When you have stiff muscles, the joint grates instead of gliding.
Okay.
So I think flexibility is one area which I see often neglected, even in the elite athlete. We all keep on working out in the gym, doing a lot of leg press, squats, lunges. But what happens is every time you're doing weight training, the muscle only becomes shorter and tighter.
Yeah.
And if you have tight muscles, they don't allow your joint to glide. The joint starts grating. And that is why when people come to us saying that my knee is making a lot of clicks, crepitus, noises, it's all because they have very tight muscles. On the other hand, you have people who don't understand the importance of strength.
Yeah.
And this we see in the post-operative period. We have operated on patients and then suddenly they find that they are not able to return back to sports. And that is because they have not done adequate rehab.
Yeah.
They have not worked on their quads, their hamstrings, their core, because all this works in unison to protect the knee and functioning of the knee.
How does one decide, or how do you decide what needs to be operated versus what doesn't need to be operated,
So I think when patients come to me, I really am not looking to put them under the knife straight away. I want to understand what is impairing, what function is being impaired by the knee problem. Is it difficulty in walking? Is it limping? Is it disturbed sleep?
Yeah.
Are they having to take pain medication to relieve them constantly on? So, in case I find that either their day-to-day activities are impaired or they are not able to function to full capacity, only then, and I have exhausted physiotherapy and all conservative lines of management, only then I would think of a surgical intervention. I believe that the body is a very good healer by itself. So never rush into surgery. Let patients take their own time to decide. In fact, last month we had a patient who came to us. I had posted him for surgery, and before taking him into the operation theatre, he said, "Doc, today I have no pain." So I said, "Then why are we getting operated?"
Yeah.
So I sent him home, and then 6 months later, he came back saying that that pain has recurred. I have already done my whatever I had to do, but now I think that it is time for surgery.
You're mentioning something really interesting, and this is often a dilemma I've had in rehab as well. A patient 30, 40, fine, but if a patient is, say, post 60, 70, where they may not necessarily be in chronic pain, but you can see the joint is degenerating. How do you balance the time it would take them to get stronger, their ability to get stronger, with should I do it, shouldn't I do it? Because so many patients are sitting with this dilemma right now. They don't know, if it gets worse, will I be able to get better? But actually right now I'm okay. What is this happening here?
So very often people are addicted to certain sports.
Yeah.
Mostly I've seen in runners. They never want to give up running.
Yeah, correct.
And over years of running, their joints have really worn out. Yeah. And I try and convince them to do something which offloads the knee.
Yeah.
Because if they keep on loading the same body part over and over again, it's definitely going to wear out. So I tell them, see, what is important in life? Sports as well as your day-to-day activities. You need to walk. You don't have to limp during your day-to-day activities. So I give them the option of doing what is called balance training.
Okay.
I believe immensely in the role of hydrotherapy. So I tell them to work out in water. I tell them that cycle chalao, ghutna bachao. That means use the cycle and save your knees.
Yeah.
And then maybe you can do occasional treks. You can do, and even when you're going for a trek, maybe make use of your trekking poles.
Yeah.
So that especially when people have painful knees, they'll always say that the downhill part is the more challenging part than the uphill.
Yes.
So you need to protect the knees. I don't believe so much in the role of braces, kneecaps and stuff like that. I think your muscles are what is going to give you the bracing that is required for the knee.
For the knee. Doc, very often I see, soon as a person gets the first sign of pain, there's a general prescription of take rest, rest. And in my practice, when I've worked with people, I've seen half the time the problem is you've rested too much, and now there's so much of atrophy, there's no strength left. And actually the discomfort is because you're so weak, So how does one determine what the balance is? Like, how much rest should you actually take? And how do you differentiate between what is actually good pain and bad pain?
See, I think pain is the mechanism by which the body is telling you to hold back little bit.
Yeah.
Not completely. I believe in active rest.
Okay.
I believe that you should rest the part that is bothering you, but work out on the rest of the areas which are not bothering you. And, pain, fortunately, people have started believing that pain is harmful. And so they start drugging themselves.
Yeah.
And today, the patient doesn't realize that pain is a natural phenomenon which is going to happen. They start taking various kinds of drugs to numb the pain. But I think that is wrong. I don't believe in medication predominantly because I feel that medicines may not have effect, but they definitely have side effects.
Correct. I love it. Yeah.
So I always feel that you must try and find alternative ways of exercise where you can bypass the pain and probably overcome that pain barrier or whatever.
Doc, there's a trend that seems to happen where I'm hearing a lot of people, they phone me, they ask me, they want to explore all of these injectional procedures, PRPs, stem cells, peptides is the new thing. Everywhere I go, people asking me peptides. Some of these I'm a little scared of because it's not been around for long enough. PRP has peptides. There's not enough evidence. It's so new. What are your thoughts on when should someone actually be open to this and consider this, and what is the evidence, and have you seen that it's actually working or not?
There's no evidence at all. Basically, I have not injected a single PRP stem cells. I think these so-called new thing called orthobiologics is an expensive placebo.
Yes.
Patients are happy. Just as, previously when a patient used to come to a doctor, they used to put some pink solution in a bottle and give them IV, and the patient used to feel absolutely great. So these are very often placebo. The B complex injections used to be given routinely to patients. And today, I think this has gone to an expensive placebo, like the stem cell. And we have had patients who have exhausted their money, spending all their money on the stem cell and all these nonsensical therapies, and then realizing that the simple thing was they could have exercised or they could have undergone a minor surgery and that could have solved their problem.
Solved it, yeah.
But they are bankrupt by the time they come to us.
I have seen this. That these alternate therapies, they're phenomenally expensive. They lifespan is so short. You're right. You could bankrupt. A surgery at 10% of the cost would have fixed it.
Absolutely.
in eternity. And I've experienced this. When you're talking about placebo, like a few weeks ago, I was in Venice for the art fair because my wife works in art. And I saw one artist put out a poster. He says, art is like homeopathy. You have to believe in it for it to work. So I remember that and I started laughing. Doc, what is the role of physios in a good surgical recovery?
I think right from day one of my practice, which was way back in 1984, when people really did not believe so much in rehab, I always had a physiotherapist working with me from day one of my practice. Because I believe that it's not just post-operative. I want patients to be ready for surgery. So I believe a lot in prehabilitation, getting their muscles back, getting them mentally ready for surgery. And of course, rehab plays a very important role in our practice. And you can see that we have given so much of space, even in sports med, for rehab. And that is because I think the rehab is the key to get back to normal function.
I've seen, specifically with athletes, perhaps you see this with the normal population as well. Post-surgery, it's not the surgery that's the problem. It's them trusting themselves to go back. What's your advice to people? You've made the decision, you perhaps tried rehab, you've gone for surgery, but how do you cross that barrier, that trust, okay, I'm strong again and I can push and I can live my life? Because I see them go through the surgery and then completely dial back and go to such a conservative life where they're scared to walk, scared to trek, scared to exercise. And I don't understand, it's all superfluous.
I think sports psychology is one area which needs to be explored quite a bit, because we don't understand the mental attitudes of a lot of athletes. Some of them are extremely motivated, they are ready to get back. Some of them get back even faster than we want them to get back. So we have footballers who have gone back after an ACL in 4 months when we want them to wait for 6 months. And there are others who are not ready to go back after 1 year. And although their surgery has been much minor. So I think a lot needs to be with motivation. And I like to basically, for myself, I go on the YouTube, go to people who are much elderly and how they have recovered or what motivates them. I think there are two things. One is intrinsic, what is within you, motivation, and one is extrinsic. I think extrinsic motivation is also very important. You need to be surrounded by people who are positive,
Yeah.
and not people who are negative.
Of course, 100%. Doc, what's your advice to young physios, who are starting a practice? Physiotherapy, we've battling this, like you said, you had a physio from day one, but for everyone else in the country, they seem to be outliers, they're struggling to manage. How can they build a multidisciplinary practice? And what's your advice to them?
I think physiotherapy has come a long way from just ultrasound therapy.
Yeah.
I think physiotherapists need to do two things. One is continuously keep on evaluating what has happened to your patient. Make sure that every patient is different.
Yeah.
A person with low demand versus a person with high demand. So you have to individualize
Correct.
your treatment plan. Secondly, don't get fascinated by all the machinery. You can do simple things like TheraBands, weights, home exercise programs, and work on that.
Yeah.
Today, I find a lot of people using these vibrators, needles, all kinds of stuff. And I think what they have forgotten is the art which is there in your hands.
Yeah.
And touch is very important. So very often patients come to me with a mild flexion deformity, and I just touch them and release their posterior capsule, which is tight, and they feel much better.
Perfect. Yeah.
And they said the physio has been giving me a vibrator and touching the vibrator. I said the vibrator doesn't have the touch feel.
Yeah, correct.
So use your hands.
Yeah. I think
And use your eyes. Just as we clinicians use your eyes to observe what is happening to the patient. Has anything changed? I think that is important. The clinical judgment.
what you're saying is so spot on. When I did heal and we ran my physio business, first 6 months when a new person came, I didn't allow them to do anything except soft tissue work. And I keep telling physios, if you cannot feel it, you can't use the tool. The tool can only be applied to what you can feel. So what you cannot feel cannot be healed, 100%. So one question specifically about the knee and this injury, almost every third or fourth person I see has a meniscus tear, and the question is, obviously with meniscus, some days it's painful, some days it's not. And the question is, when do you actually operate it? So having seen so many of this, what is your advice? Because I had it, you operated my meniscus.
I had it
Yeah.
in 1989.
And you don't know when the pain's going to come. You actually, like it comes at any time and you could be debilitated. What's your advice on people with that particular injury?
So if the number of days with pain are more than without pain, then you think of surgery. If you have to take medication, definitely think of surgery. And if your lifestyle is disturbed and it's constantly bothering you, then you may think of surgery. But today's tendency is to look at the MRI and see the MRI and say it shows a grade 3 tear, let me operate.
Yeah.
But the patient has no problem.
No problem.
So don't operate on the MRI, operate on the patient.
Yes.
See the patient.
We were speaking to Dr. Daftari and I was asking him the same thing. I said, he only looks at scans and he says, this is why I have to work with the doctors. And I remember I was telling everyone, we had a wonderful conversation with him and I was explaining to the audience that I said, he's very funny, he's very talkative because he's looking at a screen the whole day. So as soon as he's speaking to someone, he gets very, he's very excited. I've had some of my best days up there. Doc, thank you so much. When's the next cycle ride, by the way? What's the next race?
There's no race because of the unforeseen circumstances. We don't know where we can travel, we cannot travel. But I usually plan some long trips. Now Sri Lanka is my favorite destination to cycle because it's a 2-hour flight. You have lovely roads, you have good food, and you have from the sea to the hills, you have everything in Sri Lanka.
Correct,
So anytime I get even 3-4 days, I just fly to Sri Lanka, cycle there and come back.
Amazing. Doc introduced me to cycling and I'm still now in Barcelona. Girona is the cycling capital of Europe. So I keep going in there, riding in and around. Not as much as you, but I really, really love it. And 20 years later, running is still my thing. I'm still on there, but I'm trying to look after. He was the one who taught me deload the joint. So split up the running and the cycling, and it actually made a massive difference. I saw my speed increase quite significantly because of that. Doc, thank you so much. It's been such a pleasure.
Thank you.
Thank you.